Thank you for coming today. I'd like to welcome you on behalf of the CCTST. My name is Lori Crosby, and I'm one of the co-directors of the Community Engagement Core for our CCTST. So today we're going to provide you with a little bit of an overview of the CCTST. What is it and where does the Community Engagement Core fit in? And then we're going to talk about our Community Leaders Institute, followed by our Community Health Grant Program, our Partnership Development Program, and then at the end, we'll leave plenty of time for questions and discussions. We'll actually take some questions in between the programs. So after we talk about the Community Leaders Institute, if you have any questions at that point, I'll be happy to answer those questions. All right, so the CCTST stands for the Cincinnati Center for Clinical Translational Science and Training. And our overall objective is to improve the efficiency of research. We also want to improve the amount of research that comes from the community to the academic health center and from the academic health center out into the community. So we really want to create that pipeline and make sure that things that are discovered reach the community before what is typical, which is 17 years. And so the National Institutes of Health created these CTSAs, or ours is called the CCTST, at about 60. They have funded about 60 of them across the country. And we are fortunate to have one in Cincinnati. Ours is a lifespan CCTST, so it covers 0 to, I don't know, 120, whatever we think the end of life is. And it's nice because it's a great partnership between Cincinnati Children's and the University of Cincinnati. And so we're happy to welcome you all here from our CCTST and specifically from our Community Engagement Core. So in an effort to build that infrastructure and create that pipeline from community to the academic health center and back, there we have a Community Engagement Core. And our goal is really to improve health outcomes and eliminate health inequities through community partnerships, community research, and community training. And this is just a little summary of how our core is organized. So under the CCTST, we have our core, and our core works closely with the group called our Community Partner Council, which some of you here today are members of. Our Community Partner Council really helps us to implement our core, and they guide our direction and make sure that we're keeping the pulse of the community present in all that we do. We're organized currently in 3 arms. We have a research arm, a training arm, and a community partnerships arm. And Dr. Farah Jaquez will be talking to you later about our community health grant program and our partnership development program, which fall under our research arm. I will be talking to you about our Community Leaders Institute, which falls under our training arm. And then we give out a number of awards to celebrate academic and community partnerships, and that falls under our community partnership domain. The CCTST has a number of priority health areas. These include childhood asthma, mental or behavioral health, infant and maternal health, obesity, primary care and prevention, adult neuroscience, substance abuse, and the social determinants of health, and early literacy. And this year, we've also added a focus on COVID-19. And there we're really looking at the impacts of the social, behavioral, and economic impacts of COVID-19, both how it's resulted in highlighting those inequities and programs to address that. We're also supporting programs that are looking at COVID-19 infection rates and prevalence, as well as vaccines. So we're really focused on a number of studies related to COVID-19 and a number of research priorities there. We hope that all of you, if you're not already, will become a member of the CCTST. It's very easy, a quick registration. It probably takes seconds to register, and then you can register if you're a community partner or if you're a member of the Academic Health Center, meaning you work at UC or Children's. All right, now it is my pleasure to talk with you about the Community Leaders Institute, one of my very favorite programs. The Community Leader Institute, CLI, is an 8-session leadership and research capacity building program. We have 7 didactic sessions and 1 project presentation session. And our sessions cover a wide range of skills and areas that the Community Partner Council and our Community Engagement Core felt were essential to building a good academic community partnership research project. And so we want to make sure that our community partners have the skills and support they need to be able to conduct high quality community-based research and community engaged research. So in an attempt to do that, we developed the Community Leaders Institute, which not only provides training in these areas, but also provides a small grant so that individuals can apply what they have learned. You can see here, we cover a number of areas, including quality improvement, program evaluation, accessing public data sets, community research ethics, design thinking, survey development, and grant writing. So who is eligible for our program? We typically have 3 tracks, a community leaders track, and a community leader is anyone who works at a community-based organization. You do have to be a not-for-profit or nonprofit organization. If you work for that organization, even if you do not collect dollars, but you're listed as personnel or staff for that organization, then you would qualify to be a community leader. We also have community health advocates in our program, and these are volunteers at various community agencies who want to conduct a community-based project, a health-related project. In addition, we have a number of auditors from Children's, UC, or the VA who are not eligible for grant funds, but who can attend the program. We welcome proposals for any type of health-related project, but we do try to give priority to our priority health areas. If you are a community leader, meaning you work at or considered staff at a community organization, then your organization will receive a $1,500 grant for participation and completion of a health-focused project. If you are a health advocate, the organization that you're working with will receive $1,000 to complete that health-related project. Typically, the funding year goes from April through March of the following year. This was just a copy of our program, our Community Leaders Institute, which was featured in our community benefit report. At that point, we had trained 156 community leaders from 94 different organizations, and they had brought about $5 million back into our community based on the skills and training that they have learned and partnerships that they have made. I'm happy and delighted to say we're now at 204 participants from over 100 organizations. We have also now leveraged more than $5.5 million to bring back into our community through grants and contracts. We've had some academic products as well, 12 posters, 4 peer-reviewed publications. In addition, many of our leaders have become Community Partner Council members, and 3 of them have become CLI instructors. And we have developed some secret sauce, which we're going to try to replicate virtually this year, because 100% of participants agree that they have been satisfied with the quality and format of the Community Leaders Institute. So we're hoping that continues this year as we move to a virtual platform. This is just an example of some of our participant agencies to date. So you might be wondering who comes through the CLI. You can see it's a variety of sectors, from childhood education, early childhood education, to public health, to faith-based communities, to recreational organizations, to first responders. We've had both police officers and firefighters come through our program, as well as many other local organizations. Applications for the CLI are due on December 17th. Applicants will be notified of their status by February 1st, and our program this year will start on February 19th, 2021. I'm looking forward to 2021, so I'm excited about that. So I'm just going to go through now a few frequently asked questions, and then I'll open it up to questions from the group. So what are some common reasons that individuals decide to participate in the CLI? Sometimes it's they are going to have a partnership with an academic partner and they've really not worked with an academic partner before, and they sort of want to learn the language and get some exposure and have the opportunity to meet others. Sometimes it's a lot of networking. They want to come through because they want to network and meet other community leaders in the area. Some leaders wish to improve their grant writing skills. Some know they have a terrific program, but it's hard for them to find those right outcomes to demonstrate how great their program is. So they want to come through and learn that. I think all of us still, even to this day, want to learn about how to design good surveys because we want to make sure that the data we capture is good data and accurate and really tells our story. Some come because they want to learn more data analysis skills. How do they put together a really strong program evaluation program evaluation plan and evaluate those outcomes, and what kind of analysis is best? Some really want to get a sense of local and national data related to their particular focus and how they can leverage that in grant applications and also to tell their story better. And then some are just interested in more those partnerships around research. So how have past CLI participants used the information they learned in their organizations? One of the things we love about our CLI graduates is they not only complete their project, but they go back and train others in the skills that they've learned. And so some of them have developed a needs assessment survey for their organization. They've created a program evaluation plan and analyzed that data. They, again, use that local or national data for a grant application. They've conducted staff trainings. They've developed a database, track program goals and progress. And some of them write grant proposals, which bring that money back into our community. Excuse me. So I just wanted to give you an example of 3 programs to give you an idea of if you're thinking, maybe this program is for me, but I'm not sure. So there was a program, an individual leader in the community, Megan, who had a program called Giving Kids a Fighting Chance. And it was an after-school boxing program that not only took inner city youth from one community and taught them how to box, but also provided them with tutoring. And Megan really felt like her program was effective. She could feel it in her gut, but she wasn't sure exactly how to put it all together to make sure that her data could tell the story. And she had a lot of good qualitative data that participants had said to her, and she could use their quotes in different presentations, but she wanted that quantitative data. And she also wanted to make sure that there wasn't something she was missing. And so she was able to collect data from report cards from kids. She was able to collect other academic skills data from the kids and tutors. And she was able to put that and the other boxing data she put together to really show, after the CLI, after learning the skills, how well her program was working. Afterwards, she was able to get a partnership with the Free Store Food Bank and offer nutrition to the kids as well. So now they were not only getting physical activity and learning boxing and leadership skills, not only getting the academic tutoring help, but also getting good nutrition while they were at the program. Another example is from Gorman Heritage Farm. And so Gorman Heritage Farm, their objective was to address obesity via a mobile kitchen project. And so they really wanted to figure out how could they use the skills that they learned in the CLI to really show the impact of this mobile kitchen project. And so they developed surveys and they measured the progress, and they thought about surveys differently after going through survey development and the program evaluation courses. Before, they might have just done a strict evaluation, but here they really looked at what are we looking for change in, and what kinds of changes might lead to changes in obesity. So they looked at not only knowledge, but they also looked at self-efficacy, or a person's confidence in their ability to, for example, cook healthy foods. And they looked at healthy behaviors as well. What did people report doing before and after the program? Were there changes? So what happened is the program evaluation showed that there were positive trends in these areas, and the mobile kitchen was able to evolve into a cooking for the family program. And now the entire family can participate in the class. They have leveraged about $39,000 that they're now bringing back into our community based on their ability to evaluate the program and expand it. Just one more example for you. We all know that safe sleep is very important and prevents a lot of infant mortality. And unfortunately, in Hamilton County, we have one of the highest infant mortality rates in the country, especially for African Americans. And so one of our participants from the Cincinnati Health Department really wanted to identify and decrease the amount of women with unsafe sleep environments and provide education on safe sleep to women who were receiving services through the Cincinnati Health Department. She created pre-test and post-test and program compliance surveys, something that she may not have thought about before the CLI. She was able to leverage her results to show that 100% of the 140 women that they were working with not only gained knowledge, but also reported placing infants on their back to sleep during the follow-up visits. And they also did observations and other things to kind of confirm that data. The data were leveraged to develop new partnerships, and they started this program with 30 pack and plays and ended up with 600 pack and plays. That became a good problem to have, or another problem to have. They had to figure out how to distribute then those 600 pack and plays. But it's now become a standard practice for the Cincinnati Health Department, and it's also spread to other counties. And so that's just another example of some of the leaders we've had come through, some of the projects they've done, and the impact. And so I hope this has inspired you, whet your appetite, and made you excited about possible participation in the CLI. What other things would you need besides a program or a project? You also need to give us a budget. And for the budget, we need a list of items and their corresponding cost. And the one caveat is that we cannot pay for marketing or promotional materials, and that staff time cannot be covered by more than 50% of the funds requested. So those are just two caveats to think about if you're putting your application together. But make sure that your project has some outcomes that you want to measure. Tell us about how you're going to measure them and what you might use to measure them. And if you need some technical assistance and help, that's absolutely no problem. We definitely offer that. And we can also, we can look at your application ahead of time. We can look at your project ahead of time and give you feedback. And you will also be editing your project as you go through the CLI. So this is just an example of a budget. I think it helps to see something. It's one thing for me to say it, but it's another thing to see it. So you can see here that administrative support was $400 out of the $1,500. So it was less than the 50%. You could see they were doing support for focus groups in this budget. They had incentives for parents, and they had supplies and transportation. The application is very short and it's tempted to just sort of write it in, but since we definitely are in a virtual world right now, we really would appreciate if people could type it in. If you don't have access to a word processor, or that's not your favorite skill, we can also help you with that. Just give us a call or an email and we can definitely help you in that way as well. There's no cost for you to participate, and it's 100% free for everyone accepted into the Institute. So again, if you would like to get feedback on your application or you have additional questions that we don't answer today, please feel free to call us at 803-0917 or email us at ctsa@cchmc.org. And Stacy mans both that email and the phone, and she is a wonderful resource and can answer any questions for you. So at this point, I'm going to open it up for about 5 minutes of questions about the CLI, and then we'll transition over to our community health grants program. So Stacy, I don't know if any questions have come in the chat. Also, if you joined us late, please add your name and email into the chat so that we can make sure that you get the handouts from today and any additional information. If you want to ask a question, you can unmute or you can type it into the chat. I know sometimes people have a little bit of difficulty.
I have a question.
There we go.
Yes. I have one. How y'all doing, everybody? It's Sheila. So if you already had a CLI grant, are you allowed to apply again?
So if you want to come through with a team and you've already been through the CLI and you want to come a second time just to support a team member, that is absolutely fine. You could come as sort of an auditor, so to speak, to just be in the classes, you know, rehear the information and work with your teammate on a project. That would be just fine. We'd love to have you back.
Thank you. That'll be awesome. Thanks.
Mm-hmm. If there are no other questions, I do want to ask if there are any recent grads who in 30 seconds or less would like to talk about their experience, because I think it's easier to hear it from them than it is me. I know there are a couple on the call. I know Sheila. Sheila wants to come through again, so maybe she can tell you why. Why she would consider doing that.
Thanks. I wasn't, but I will. Because you pretty much covered it all. Because like I thought like what I wanted to do didn't fit in, but it is an opportunity to learn a lot in all of the areas that you guys mentioned. It was just real interesting, and it gave me it lifted my self-esteem as well, and it allowed me to have to network with other people and learn more about what I wanted to do. It brightened my ideas. It gave me a better sense of direction. I'm still connected with what I do, even though I don't have a grant at this time. It led me into other opportunities. And it's just an overall good experience. And I learned so much, especially with the data piece, because for me, that was something I was like, yeah, I have an idea, but no idea at all about the data piece. But after I went to the CLI, I was like, oh, that's it. And you guys are so awesome with support. You can call them anytime, during and after. And they're always there. Stacy was specifically the person that I probably wore her out. She was always available, but she was always pleasant.
Never, Sheila.
So I'm just grateful to be connected to CLI, and it's a great opportunity. If you think your idea is not it, or if something don't fit, please tune in and give it a shot. Guarantee they'll make it work for you. So I thank you guys for the opportunity.
Thank you, Sheila. Thanks so much. I really appreciate it. Okay. Given the time, I am going to turn it over to my co-host for today, Dr. Farah Jaquez. This is just a slide just letting you know if you're not selected, we can definitely, you can apply again, you can call us and we'll, definitely work through that with you. So now it's my pleasure to introduce Dr. Farah Jaquez, who is a professor and assistant head of the Department of Psychology at the University of Cincinnati. In her spare free time, she co-directs the Community Engagement Core with us. We're very excited about that. And she will tell you all about our Community Health Grants program and our Partnership Development Grant.
Hi there, sorry about the delay. I was having trouble unmuting myself. Okay, I also work on the research portion of this with Dr. Eric Rademacher, who's not here today, but if you know him personally, he can also answer questions about these grants. So there's two types of grants that I'm going to talk about. The first is the community health grants, which are the ones that we've been doing in a pretty similar way for the past 11 years or so. We also have a newer grant just over the past couple of years that we've been doing, the Partnership Development Grant, but we'll talk about the community health grants first. The community health grants are intended to be, it's up to $20,000 worth of funding to do a project that's a true partnership between community and academic partners. So there are researchers that are at an academic center, and then there is someone representing a community organization as well. The academic partner, it says here they can be affiliated with an academic health center, but they can be associated with any university. It just has to be a researcher at a university. The funding for this comes from the CTSA, just like all the grant opportunities that we're going to be talking about today. The CTSA is a national initiative that stands for Clinical and Translational Science Award, and we have one here, our regional one in Cincinnati is the CCTST. One thing that we're really interested in these grants is to see that the funding's divided among academic and community partners. We like to see that the partnership is truly a partnership in every way, including the financial ways. The a maximum grant awarded is $20,000. I'll talk about this a little bit more later when we talk about how the grants are reviewed, but we really are looking for how can we get the most impact in the community for the best cost benefit analysis. And so even though it goes up to $20,000, we strongly encourage you not just to pad a budget to get up to $20,000, but to truly ask for the amount that you would need to do the work that you've proposed. We've been doing these grants again since 2010, where 70 community health and 14 partnership development grants have been funded for over $1 million. And that $1 million has been leveraged in the community for almost $9 million. So we've just been really, really proud at what the people we have funded to do this work have been able to take it and grow it to over $9 million that all goes back into the community. We're also really proud of the fact that over 20,000 individuals in the greater Cincinnati area have been impacted by the work of the community partnership grants and the partnership development grants. So there are so many past projects, as we said, over 70 of them that we couldn't even list them all, but just a couple are up here just to give examples of the broad scope of the projects that have been funded. They focused on physical activity and asthma, HIV stigma reduction, nursing, opioid abuse in Lower Price Hill, Norwood expansion of home injury prevention. So really about many different things. We look for funding in our priority health areas, but that's not the only areas that we fund. Okay, our partnership development grants, these are a little bit different from the community health grants because they're for those partnerships that maybe just be new or developing in a new way. Same thing, we're looking for academic and community partners truly working together on a project, but the maximum amount of these grants is $5,000. And the $5,000 should be spent on something that will help you to the partners start their work together. The money is typically not spent on things like hosting meetings or something like that, but on a project that you can actually get into together so that you can see, is it going to work to actually start doing research together? And for both of these grants, they're going to be one-year grants from April 1st of next year to March 31st of 2022. And so just again, reiterating what's the difference between the partnership development and the community health. Partnership development's up to $5,000. It's for newer developing partnerships. It can contribute to a pilot study or a needs assessment, whatever is needed to find out what it takes to get you all working together. What we're really hoping for, and one of the ways that those grants are reviewed, is thinking, will this project push this partnership to the next level? We're looking to strengthen collaborations that you can leverage to maybe next time go for a community health grant or some kind of other grant mechanism. An important thing about the proposal is to show that you have plans for the partnership to continue beyond the grant period. We're hoping not just to fund something that lasts for 1 year, but to build something in 1 year that will later be expanded to long into the future, hopefully. And then the community health grant, usually people have some kind of evidence of working together in the past. That's not absolutely necessary, but typically the people who are funded have some evidence of past collaboration. Again, we're looking for that $20,000 or whatever the funding that you're asking for to be evenly distributed among the partners. We've seen, honestly, both in the past where the grant says it's a partnership, but all the money it goes to the academic partners to cover their salaries, which isn't showing a true partnership. We've also seen it the other way, where all the money might go into the community partners to fund maybe some staff salary. But again, that doesn't show that there's a true collaboration between the research happening in the community engaged settings. Same with the community health grant. One of the criteria, which we'll talk about in a minute, is sustainability. So we're looking for goals beyond the grant period. Past partnership development projects. Again, there's many different types. We really are blown away every year at the innovation that comes to us through these grant mechanisms. So we're excited to see the future. But in the past, we funded a UC student-run free clinic. They were doing a needs assessment so they could get started on which they're now running their student-run free clinic. Working with the homeless around chronic pain, looking for doing research with detained girls to understand their needs, looking at a diabetes-friendly food pantry shelf program, and just some examples of what these partnership development grants. Again, I hope that the take-home message from this is the scope of what can be funded is very great. Okay, the timeline on this, the letters of intent are due December 2nd. These are, we'll get into what these are going to look like soon, but they're simple. We're looking who are the people who are partnering? What do you think you're going to be spending money on? What do you think you're going to be doing? Eric and I look at all of those letters of intent and we give individualized feedback on what we think, what we would advise you to add into your proposal to make it as strong as possible. Those letters of intents are not required, but we do try to look at everyone individually so we can help. So we really intend it just to give us an idea of how many applications we're going to get, and also so that we can help make applications as strong as possible. The final proposals are due on January 21st. The reviewers will go over them in January and February, and the applicants will be notified in mid-March of their funding status. Grant funding will start on April 1st and go through exactly 1 year. So again, the letter entry process is designed for us to know how many applications we're getting. Every once in a while, we'll get an application that just doesn't align with what we're looking for community health grants. And to be really honest, what the most often example of that is it's a academic only scientific grant that they say that they have a community partner, but it's really a traditional academic NIH type grant. We really are looking for grants that are true partnerships. And so if it does not reflect a true partnership, we'll just try to say in the beginning that it's not a good fit. The LOI doesn't guarantee funding. This is, again, just to let us know what to expect and to give feedback. What you decide to do in your grant proposal can absolutely be different from the LOI. That's okay too. Eric and I typically spend a day going over all of the LOIs and trying to get feedback together. And we have it in our calendars to go over those before December 2nd, so we can try to get feedback to allow you to get started on applications early in December. Okay, again, letters of intent, we're looking simple. We want name, title, contact information. Who are the partners who are working together? Have you worked together before? Why are you interested in this opportunity? And what do you think you might do? Another thing that's really important in this is describing how you're going to evaluate what you're going to do. So for example, if two people, or if partners are coming together to do an intervention, we need to know what's the plan to evaluate that intervention. So that's just mentioning a general idea for that is really helpful in the LOIs. Now for the full application, you'll email those to the CTSA address. It's a 6-page limit for the community health grant and a 4-page limit for the partnership development grant. There's also a face page that we ask you to fill out. Every reviewer will see the face page. So that just makes it easier for everybody to see a little bit about everything. We really like to see the appendices be as concise as possible. Sometimes we have people send in their 50-page CVs, and that just means that Stacy ends up doing a lot more printing that's not necessary. So trying to keep those limited, we ask people to do. We also like to see letters of agreement for all the partners who are involved. And again, the main reason for that is that we are really looking at have the people who are the partners on this work together to form this proposal. The proposals that are the strongest are the ones where it's really clear that they've talked it over, they have come up with a plan together, and everybody has a role in the project. Those are the strongest proposals. The face pages, which are the instructions for this, are part of the packet that's in 1 page or less. Okay, so the checklist for competitive proposals. I think I've been harping on this a lot, but the reason we harp on it so much is because it's the most common problem that we see. We're looking for collaborative proposals that demonstrate strong academic community partnership, that we have the academic partner who's associated with the university or is a researcher, and that we want that budget evenly distributed to reflect that true, authentic partnership. Another way that the reviewers look at the proposals is to see, is something innovative happening that's actually going to improve health outcomes of children, adults, and community. So we have had proposals before that say that there's this intervention that's really well known and we know it works really well in Cincinnati, so we want to do it again. That probably isn't going to be as competitive as saying a proposal that describes people coming together to do something new or to take something that's existing and implement it in a new way or with a new population, something that brings some innovation, because these community academic health research projects are not only to have an impact on the community, which is 100% our major goal, but we know that this type of research, community being involved in research, can also improve science. And we want for this work to be published so other people know that community partnered research is rigorous and can contribute to science as well. So having those research descriptors are also really helpful. Clearly articulated program goals that go beyond the grant period. So not just that we're going to do this and then it's done forever, but what's going to happen after this project is done. And I think that the absolute goal is that these projects can be used for pilot funding that might then be used to apply for bigger grants to broaden the scope or the impact of the work together. Okay, the review process. This happens early every year. And I think something that's really unusual about this grant opportunity or this grant mechanism is that it is reviewed not only by people with research experience, but it's also reviewed by community partners who are constantly asking, why does this matter for the community? What impact is this going to have on the people that live in my neighborhood and in my community? So the people who are reviewing it are reviewing it really for both the community and academic goals in mind. The way that the reviews are weighted are on strengths of the project, or there's a rating that's given to each of these: strengths of the project, strengths of the partnership, how well does it fit with the CTSA priority areas, the potential for impact, and the funding amount. And honestly, the way that those last two look in partnership, having been involved with this for several years now, what the conversation usually comes down to is if two applications are really good, but one of them is going to be able to help more people or help people in a really significant way for less money, the cost benefit analysis does often go in there, which is why we really encourage people to ask for what you need to get the work done, because that's often comes into the conversation during a review. Every application is reviewed by at least 3 reviewers, always at least 1 community member and 1 academic partner. All of the scores go in, and Stacy creates a huge spreadsheet so that there are average scores across reviewers. This is where I usually like Eric to talk, because he has a highly specific system to him about how he figures out how we're going to discuss things in a way that's the most efficient. But we kind of have it down now where we end up talking about the ones that have the highest scores first, but there's always a chance to pull lower scored ones into the discussion. Also, we always look at ones where maybe only the scores were pulled down by one low score, and we always make sure that we discuss those as well. So we really try to make sure that every single proposal application is really considered, and if not discussed in person, if the only reason it would not be discussed in person is if it got universally low scores or just didn't seem to be a good fit. This is again just the different categories that we look at, and all of them are rated on a 5-point scale. And everybody will know the funding decisions by mid-March. If you request it afterwards, written feedback will be provided based on the notes of the reviewers. Stacy tries to keep notes during this review session. So after, I think maybe I didn't mention that enough before. Actually, yeah, let me go back. So what happens after every application is reviewed by 3 people, we all come together for a meeting that's usually in person, but this year I suspect will be virtual, where we have a conversation and discuss all the grants. And not only are those scores considered, but also the priority areas, the potential for impact, and how much money we have to be able to recommend funding for. So all of those factors go in during an in-person meeting. Okay, questions or comments? I feel like I have been talking for a long time too quickly. So please ask me any questions about the community health grants or the partnership development grants.
This is Val Barron's father.
Yeah.
You had mentioned early on universities.
Yes.
At Safe Pastures, we have had our best successes with either certification programs centered around something like Cincinnati Cooks, or also with Cincinnati State. So my question is, when you say universities, does that include institutions like Cincinnati State?
I'll let Lori jump in if I'm wrong about this. I think Cincinnati State would absolutely count. What we're looking for is that somebody has the academic or research expertise to help with the science part of the project, the evaluation. So if you're doing a program, that there would be somebody who is well qualified to evaluate the program or to help with that aspect of things. Would you say that that's true, Lori?
Yeah, Cincinnati State would, in fact, count as an academic partner.
Okay, thank you.
Thanks for that question.
Mm-hmm.
Hello, this is Sheila. I was wondering the same thing. So I was wondering, they don't have to be like a UCB from a university, as long as they're in the academic research health department. Is that true, or do they have to be like, can it be like Mount St. Joseph or something?
Yes, it could be Mount St. Joe, definitely. I didn't hear the part about the health department exactly, but usually the health department folks
They have to have some. Go ahead.
Usually the health department folks are service community partners. So yeah, I think Mount St. Joe or somebody who's associated with a college or university or a research institution.
Okay, thank you.
Yeah.
This is Loretta with Starfire. I guess I wanted to ask, I'm a little fuzzy on the distinction between like if this is for program development or if this is research in its own right. So we're only looking at the partnership grant, but like is the end goal to inform and develop a program, or is it to have research that's widely accessible to any program, including our own? If my question makes sense, if there could be a little bit, if you could talk to that a little bit.
I think the way that it sounds like, so for the program development for your own program, working with an academic partner as to evaluate the program to develop it for your own use is absolutely within what we would be thinking about. And especially for the partnership development grant, that sounds like a great fit. Like starting a relationship with a researcher, starting a partnership with a researcher to help you figure out how to develop your programs in a way that's based on evidence is definitely within the scope of what we have funded and are look highly on in the review process.
Thank you.
Yeah.
I have a question, Farah. Do you have to apply for the entire $20,000?
You sure don't, Lori. In fact, if you do not need the entire $20,000, we would encourage you not to. And just to be honest, the way that this usually ends up is, you know, we have certain grants that we want to fund, but we have 10,000 left over, but then there's two people that ask for 5,000 each, and they sound like great projects. Wonderful. Now we can fund it all. So it really helps, and it really is reviewed well if people think, well, this sounds like a pretty good project, and wow, they're going to be able to do something with 100 people, and they're only asking for this much money. That's the kind of talk that happens during this review process that is usually, yeah, it really influences funding, the ideas. It influences funding if you can be cost efficient. Okay, I see a question here from Andrew Wood. Do the community partners have to be purely local, or could they be a local branch of a national organization? They could definitely be the local branch of a national organization. I'm sure that we've had that happen before. I can't think of an example off the top of my head, but I'm feeling like maybe with the American Cancer Society or something like that. I know that we've had things like that happen before.
Yes, and to that point, we have also had CLI projects with the American Heart Association, the American Diabetes Association. So local chapters are definitely fair game.
Well, if people don't want to get into details about your projects, or you have questions, what usually happens when we do all this in person is that there's usually people who stay after and talk to me individually. And so that's a little bit harder to do in this setting, but you can definitely email me. I'll put my email in the chat, or we can set up a time to talk if you have questions about your specific project.
Okay, any other questions? Like the quickest pre-application session ever. I just wanted to pop on with my video on for people who don't know me. My name is Stacey Gomes. I'm the coordinator for the Community Engagement Core. And feel free to definitely contact me at any time if you have questions about the application process. And I also wanted to remind anyone who came in a little late, if you haven't already provided your email address in the chat, please do. I'll be sending out a link to all of the applications and requests for proposals for everyone. Those are also available on our website. And just a last reminder that we are co-hosting with the Collaboration Network a 2-hour kind of seminar on racial and health inequities exposed by COVID-19. Some of you may have attended our session last week with Dr. Watson from Chicago. We're going to kind of shift gears and start focusing on ways we can collaborate to start addressing the inequities we're seeing in our local community. So if you're interested in that, feel free to scan the QR code. I'll include this flyer in the email as well. So thanks, everybody.
Thanks, everyone. We really appreciate your attention today. Have a good weekend.